Ladies and gentlemen, our speaker for today.
Hello everyone! Thank you for having me today. Breathe in, breathe out. How are your lungs today? I am Dr. Nibla Osef Alalde, 32 years old, a pulmonologist from Manhattan Medical Hospital. In observance of the National Health Awareness, today I'm going to talk about your lungs. How well do you take care of them? Do you know how important they are? So, I invite everyone to stay with me as I go through our topic, its functions, complications, how you will treat them, and what you can do to avoid them. Plus, my personal tips on how to improve your breathing towards the end of the topic. I want to share some knowledge and awareness about this very important organ of the body. I chose to discuss the lungs because of the COVID-19 that directly targets our lungs. Hospitals everywhere as we speak right now are fully booked with COVID-19 patients. If you could see them, they would look pink and rubbery on the outside. Inside, they look a lot like sponges. Air comes down from your nose or mouth to the trachea into two large tubes called the bronchi. The lungs are like a pair of spongy, air-filled organs located on the either side of the chest. The lungs are primarily responsible for removing carbon dioxide from the blood and adding oxygen to it. In other words, its important function is to take oxygen from the environment and transfer it to the bloodstream. The importance of the lungs is for us to breathe. We breathe because oxygen is needed to burn the fuel in our cells to produce energy. Oxygen is brought into the lungs via breathing, where it is transported by red blood cells to the entire body to be used to produce energy. The lungs are also responsible to help the other organs of the body. It allows the body to talk and to smell. Our body have different humidity levels. So, the lungs help to bring air to the body temperature and eventually moisturizes it. When the body exhales, the body lungs help in removing waste gases including carbon dioxide. They are also the one protecting your airways from harmful substances and irritants. The two most common types of complications in lungs are asthma and lung cancer. Asthma is exposed by an allergy that triggers signs and symptoms. It causes inflammation in the airways that can make breathing difficult. Some symptoms include shortness of breath, chest pain, chronic coughing. Asthma can't be cured, but its symptoms can be controlled. Experts recommend some breathing exercises like Buteyko breathing technique and Papworth method. Incorporating garlic and ginger in your diet helps due to their natural anti-inflammatory properties. Some ingredients like honey and caffeine soothes the throat. Alternative healers recommend yoga and acupuncture in some cases. Lung cancer is a disease which is usually caused by smoking. The damaged cells grow and multiply abnormally. It typically doesn't cause any signs and symptoms in its earliest stages. Signs and symptoms of lung cancer typically occur when the disease is advanced. It includes coughing up blood, shortness of breath, chest pain, bone pain, and headache. Treatment of lung cancer is so expensive. It's not a joke, and it takes a series of treatments. People with non-small cell lung cancer can be treated with surgery, chemotherapy, radiation therapy, targeted therapy, or a combination of these treatments. To prevent lung cancer, people should stop smoking. Keeping your lungs healthy means avoiding pollutants. Quit smoking, don't smoke, stay away from secondhand smoke and chemicals. Wear a mask if you are exposed to fumes, dust, or other types of pollutants for any reason. Eat a healthy diet with lots of fruits and vegetables. Drink water to stay hydrated. Exercise regularly to keep your lungs healthy. Prevent infections by washing your hands often and getting a flu vaccine each year. Well, like I promised you earlier, without further ado, here are my personal tips for your lungs exercise. Number 1, diaphragmatic breathing, also known as belly breathing. Engages the diaphragm, which is supposed to do most of the heavy lifting when it comes to breathing. This technique is particularly helpful in people with chronic obstructive pulmonary disease. practice the diaphragmatic breathing technique, first relax your shoulders and sit down or lie down. Second, place one hand on your belly and one on your chest. Then inhale through your nose for 2 seconds, feeling the air move into your abdomen and feeling your stomach move out. Your stomach should move more than your chest does. Next, breathe out for 2 seconds to burst. Pursed-lips breathing can slow down your breathing, reducing the work of breathing by keeping your airways open longer. This makes it easier for the lungs to function and improves the exchange of oxygen and carbon dioxide. To practice pursed-lips breathing technique, first inhale slowly to your nostrils. Second, purse your lips as spouting or about to blow on something. Then breathe out as slowly as possible through pursed lips. You should take at least twice as long as it did to breathe in and repeat the process. Like what I said earlier, to breathe is to live. Sometimes we take our lungs for granted. They keep us alive, so it is important to prioritize your lung health. Ladies and gentlemen, health is wealth. Once again, thank you everybody for staying with me. I am your doctor saying, stay healthy everybody. Bye for now!